got a request in the comment section under one of my videos. Somebody wanted to know about a peptide. Now, peptides are very popular currently. Peptides are defined as short chains of amino acids. They can vary anywhere from 3 to 6 amino acids. They're just small chains of amino acids. Polypeptides are larger chains of amino acids. For example, you have, let's say, growth hormone. Growth hormone is a polypeptide hormone. It's composed of about over 100, I don't remember the exact number, over 100 amino acids in a particular sequence. But peptides are small, just a couple of amino acids. Peptides are unique in the sense that they could be absorbed intact. Normally when you take a protein, let's say a whole food protein, when you ingest it orally, it goes through a process of digestion that initially begins in the stomach, where the whole protein is turned into, it's converted into polypeptides through the actions of hydrochloric acid in the stomach combined with an enzyme called pepsin. And then the polypeptides go into the intestine. They're further acted upon by specific digestive enzymes called proteases. And in that sense, they are converted into amino acids. The amino acids go through a further process related to uptake, where they have to be kind of combined with certain specific amino acid carriers to get absorbed into the blood. Some of the amino acids unfortunately compete with others for certain amino acid carriers. That's a whole different ball game. I don't want to get into that. But my point in telling you this is that peptides, because they're just small, let's say again 3 to 6 amino acids in a particular sequence, they can be absorbed intact. So as a result, they have active biological properties. And some of them, I'm sure you've heard, I've talked about in previous videos, BPC 157. There's another one called TB 500. These are all they're naturally produced in the body. They also have been isolated, and they're sold for their alleged therapeutic benefits. Now, why do I use the word alleged? Because while there is animal and in vitro or test tube evidence of the effectiveness of a lot of these peptides, there isn't a lot of human evidence for it. With the probable reason being for that is that the fact that they're natural elements, they're naturally produced in the body, and as a result, pharmaceutical companies cannot place patents on them and package them as drugs because they just can't do it. So as a result, the pharmaceutical companies, or big pharma, if you want to call them that, they don't want to spend the money needed to prove the effectiveness of some of these peptides in human physiology. They just won't spend the money. So as a result, there's more or less a dearth of studies to show that these peptides work. There is a pretty good amount of animal research, and only about half of animal research, let's say rodents, rats, mice, can be extrapolated to humans. A lot of what happens in a rat or a mouse doesn't happen in the human body. So you always have to be careful of animal studies. That's one of the reasons why I generally don't cover or talk about animal studies in my Applied Metabolics publication, because there's no guarantee that the results of an animal study can be applied to human physiology. Although a lot of people on the internet, blogs, videos, lead you to believe that, that this mouse study that showed you could gain 200% more muscle, just take this and you'll get, it's a nonsense. It's not based on any science. So I'm just being upfront and honest with you and telling you, as a preface to what I'm going to talk about here, that the substance I'm going to talk about is also a peptide, one that I have to admit I'm not familiar with. I had to dig out some research papers to understand it, but this person somebody left a comment under one of my videos, asked me to do a video on this substance. It's called GHK copper peptide. Now, the GHK, it's a tripeptide. It consists of 3 amino acids, glycine, histidine, and lysine. It's in a particular sequence. It was discovered back around 1976, I believe. I'm sorry, it was discovered in 1973. I'm referring to a paper on it because, frankly, I have to admit, I'm not going to lie to you, I knew almost nothing about this stuff. The stuff's been around for a while. This, I'll call it GHK peptide rather than GHK copper peptide. Although the copper thing is important because the fact that it chelates or kind of attaches on to copper is what gives it a lot of its activity, biological activity. Copper might be familiar to some of you viewers who are more, let's say, educated in nutrition. Copper is a trace mineral that's involved in red blood cell production. It helps also in the metabolism of iron, and it's very difficult to get a copper deficiency. Copper is found in a lot of protein foods, a lot of meat. However, it is possible if you take in, for example, excessive amounts of another trace mineral called zinc. If you take in, let's say, maybe 70 to 100 milligrams of zinc on a regular basis, and you're not eating copper-containing foods like meat and other animal protein foods, there's a good chance you actually could be copper deficient. However, a more likely scenario is you're ingesting too much copper, because you get copper not only from foods, you also get it from water pipes and various other sources. So there's a consequence. There's often too much copper, and copper is normally transported in the body attached to a specific protein. When copper is attached to the protein, it just acts as an enzyme stimulator, a coenzyme. Like I say, it helps build red blood cells. It's needed for the production of collagen and elastin, which also relates to what I'm going to talk about with this peptide. But the point being that one serious side effect of not having enough copper is that the aorta, which is the large vein, is it a vein or an artery? I guess it's, let me think. The aorta, I believe it's a vein, a large vein. I could be wrong about that. It's been a while since I studied human anatomy. But anyway, it's a large blood vessel leading from the heart, and with a copper deficiency, because of the lack of adequate connective tissue rebuilding, the aorta can actually break down, and if the aorta breaks down, you could die. I mean, you could actually die of cardiovascular disease. But again, that's another story. But let's today talk about GHK copper peptide. Now, the stuff, what this stuff does, GHK, as I said, it's a tripeptide, 3 amino acids. It has a tendency to strongly chelate to copper. And once it chelates to copper, it provides a number of beneficial actions. Now I'm reading from this paper here. According to the research, now again, I have to put a proviso on this. Most of the research showing the effectiveness of GHK copper peptide has been done in vitro, meaning isolated cell studies, or in animal studies. However, it is used in human cosmetics. It's been around for a while. So the likelihood is that it provides most of the actions which I'm going to discuss here. But there isn't a lot of solid human evidence to prove it. Okay, it says here, for example, GHK copper peptide is able to tighten loose skin and reverse the thinning of aging skin. So a lot of aging skin is caused by a breakdown of the two major skin proteins, which is collagen and elastin. Collagen is your main supporting skin connective tissue protein in the skin. Basically, it kind of keeps the skin up there. It's like the foundation of a building. Elastin is, as the name implies, is what keeps the skin elastin. When you have sufficient collagen and elastin in your skin, you don't get fine lines and wrinkles. Those are caused by the breakdown of collagen and elastin. What is the major cause of breakdown of collagen and elastin? All you got to do is look up. Ultraviolet rays of the sun are the number one major cause of skin aging, because it damages DNA in the ultraviolet rays from the sun, damage DNA in the skin, and this leads to a breakdown of collagen, elastin, and wrinkles. Now, this stuff, GHK copper, actually it promotes, it stimulates cells called fibroblasts that produce collagen and elastin. It also inhibits enzymes called metalloproteinases, which break down collagen and elastin. So the net effect is it will tighten loose skin, and it'll also reverse the thinning of aged skin, so it'll make you look younger. That's why it's in a lot of cosmetics. Now, a lot of people, a lot of men and women, when they get past, let's say, 60 or so, depends. Even if they're working out, if they're, they have a great diet, you get loose. You get this loose skin. I admit I have it, like on my arm, and when I flex on the bottom of my tricep, it's disparaging to look in the mirror. When I flex my bicep, I see this loose skin. This is an aging effect that's, again, caused by the breakdown of connective tissue in the skin. I don't think this is related to sun exposure because it's on the underside of my arm, which has never been really exposed to much ultraviolet light. I think it's simply an aging effect. Now, would taking, let's say, if I had a topical version of GHK copper peptide, would it tighten loose skin? I don't know. There's no research to show that. What the research does show is it is able to tighten loose skin and reverse the thinning of aging skin. So it may or may not have affected, let's say, the loose skin that's. By the way, Arnold has it too. If you look at videos of Arnold working out, like when he does pull downs, if you look at his arm, you'll see the loose skin he has in the same area I do, the bicep, as do many bodybuilders who are over 60 years old. And now it also repairs protective skin barrier proteins. There's one called ceramide, for example. These things basically hydrate the skin. They kind of puff up the skin to make it look younger, fuller, and healthier. So that's the protective barrier of the skin also breaks down with age. And again, the studies show that GHK copper peptide can also repair damage to the protective skin barrier proteins. As of course, by doing both of those things, meaning that it reversing the aging and thinning of the skin, it increases the skin firmness, elasticity, and clarity. In other words, it makes your skin look healthier. You have like a skin glow, so to speak. It reduces fine lines, depth of wrinkles, and improves the structure of aged skin. It smooths rough skin. It reduces photo damage. That's damage induced to the skin from exposure to ultraviolet radiation from the sun, or if you use sunbeds, can do it too. It also reverses mottled hyperpigmentation. Sometimes you get these kind of spots on your skin from exposure to the skin. Women who are pregnant also get a type of hyperpigmentation of the skin, causing these kind of browner spots. This stuff can apparently reduce it quite a bit. It also reduces skin spots and lesions. It improves the overall skin appearance. It stimulates wound healing by stimulating fibroblasts, which are the cells that produce collagen elastin. They stimulate wound healing, and it also has an independent protective effect against UV radiation skin damage. It reduces inflammation and free radical damage. When you expose your sun to the skin, the ultraviolet rays, it has an inflammatory effect in the skin that causes damage to the proteins in the skin, and it also produces byproducts of oxygen metabolism called free radicals, which attack cell membranes and also add to the aging. Another property of GHK copper peptide is that it apparently stimulates hair growth and thickness, and it enlarges the hair follicle. Now, male pattern baldness is called androgenic alopecia. And I know it sounds funny, but no man ever goes bald. I know it sounds funny with all these bald guys walking around, but what's going on is the hormone dihydrotestosterone, which is a byproduct of testosterone metabolism, in the hair or in the follicles, you have enzymes called alpha reductase enzyme, which converts testosterone into DHT. The DHT acts upon the hair follicle to miniaturize it. So in other words, the hair is still there. If you took a magnifying glass and you looked at a bald guy's scalp, you probably see these tiny, tiny little blonde hairs. Well, that's your hair follicle. That's what used to produce full strands of hair. It's now become miniaturized. It's so small that the hair looks bald, but the hair follicle's still there. Now, drugs that are reputed to help hair growth, such as minoxidil, topical minoxidil, they think it works by maybe causing the hair follicle to return to its normal rate of hair production, producing full hairs. Well, it turns out this stuff, GHK copper, also enlarges hair follicle, so it might be of use in treating pattern baldness or hair loss. So again, let's look at it. Again, I'm going through this paper here. It's a lot of technical detail, but as I said, it improves the skin regeneration because it modulates the activity of what they call metalloproteinases, which break down collagen and elastin in the skin. And by doing so, it also stimulates skin fibroblasts, as I mentioned earlier. It's been available in cosmetic form. There was one study where they gave a facial cream containing GHK copper peptides. It was applied for 12 weeks, which is 3 months, to the facial skin of 71 women with mild to advanced signs of photoaging. Again, that's skin-induced wrinkles and lines. It increased skin density and thickness. It reduced skin laxity, and it improved clarity, reduced fine lines, and depth of wrinkles. And that was a human study. A GHK copper eye cream applied again for 3 months around the eye. You see a lot of aging around the eye. I'm a victim of that myself. What happens is the structure of the eye that holds your eye is held in place over here under the eye by pockets of fat. What happens is the connective tissue that holds the fat in place tends to break down with age. A lot of it does have to do with sun exposure, but a lot of it is purely an aging effect. And when that happens, the fat that normally would hold your eye in place, it still does, but it tends to bulge out. And this is what caused the bags under the eyes, which I have. President Clinton had a really bad case of it, you might remember. But that's an aging effect. And this one this actually might help that. The eye cream was applied for 3 months to 41 women with mild to advanced photo damage, and it performed better than a placebo and vitamin K cream. Vitamin K topical cream is also thought to help reduce the eye bags and tighten up the skin under the eye. This stuff, copper, the GHK copper peptide, worked better in reducing this kind of eye bagginess than the vitamin K cream. It reduced lines and wrinkles, improved the overall appearance, and increased skin density and thickness. Another 3-month study of GHK copper showed that improved collagen production in 70% of the women treated, in contrast to 50% treated with vitamin C cream, which is also often advocated as a topical treatment for fine lines and wrinkles because vitamin C is a precursor for the production of collagen. So they put it in topical form, hoping to regenerate aged skin. This study showed that GHK copper peptide worked better than the vitamin C. And it also, in the study, like I say, 50% of the people with vitamin C cream showed improved collagen production. 70% showed improved collagen production with GHK copper, and 40% showed improved collagen production with retinoic acid, which is interesting because retinoic acid is the #1 topical treatment recommended by dermatologists to help treat skin aging, fine lines and wrinkles. And this stuff, GHK copper, was twice as effective in this human study as retinoic acid, which is the #1 topical treatment recommended by dermatologists to treat skin aging. I mean, this is amazing stuff. I never knew this. I make an admission. I'm reading this research. I had no idea that this stuff even existed, much less was as potent as this apparently is. Uh, there was another study. Again, it was a topical application of copper tripeptide complexes. They confirmed an increase in skin thickness in the range of the epidermis and dermis. The epidermis is the upper layer of the skin. The dermis is the deeper layer of the skin. It improves skin hydration, it significantly smooths the skin by stimulating collagen synthesis. It increased skin elasticity, and it showed a significant improvement in skin contrast and increased production of collagen. So then another study. Let's move on to another application of GHK copper, which is wound healing. Multiple animal studies have established the wound healing activity of GHK. It appears that GHK stimulates wound healing through a variety of mechanisms. I'm not going to go into the mechanism, but a lot of it has to do with increased collagen production. You need the greater the collagen production, the faster the wound healing. One of the reasons why taking human growth hormone speeds the healing of connective tissue injuries. This is the main reason, by the way, why athletes use growth hormone, not to get big muscles like bodybuilders. They do it because growth hormone greatly stimulates connective tissue regeneration, and it does that by increasing collagen production. So again, collagen production is involved in wound healing. Another reason, way that GHK copper peptide will improve healing of wounds or healing in general is it stimulates blood vessels, blood vessel growth. So it stimulates blood vessel growth. It also stimulates nerve outgrowth. If GHK copper increased the production of nerve growth factor and neurotropins NT3 and N4, it speeds up the regeneration of nerve fibers. This was an isolated cell study. As I said, GHK copper has antioxidant and anti-inflammatory actions, which also aid wound healing. It's also apparently GHK appears to support remodeling and restructuring of connective tissue, which would have a beneficial effect on chronic obstructive pulmonary disease such as emphysema. The expressions of 127 genes were altered in chronic obstructive pulmonary disease patients after being given GHK copper peptide. An interesting effect also of GHK peptide, which might have some application to bodybuilding, is that it blocks some of the effects of cortisone. Cortisone is an adrenal steroid hormone, which is known to cause catabolic effects in muscle. It causes the release of amino acids from muscle, which would be a muscle breakdown effect. But when applied, the studies again, this is animal studies. GHK copper, when applied systemically to mice, rats, and dogs, has protective effects on cortisone-induced inhibition of wound healing. Cortisone, by interfering with connective tissue production, actually inhibits wound healing. That's why athletes have to be careful about taking cortisone injections into their joints. If, for example, if they injure their joints, a lot of athletes have cortisone injected. The problem with that is that too much cortisone will interfere with connective tissue production and can actually break down the joint tissue. This stuff, GHK copper, can minimize that negative effect of copper. The GHK copper peptide, it's a mouthful, can also actually help prevent cardiovascular disease through its suppression of a cardiovascular risk factor called fibrinogen. Fibrinogen is involved in blood clotting. However, excessive amounts of fibrinogen is considered a cardiac risk factor. Now, the sad part is that most standard lab tests to check for cardiac risk assessment, let's say, they check for stuff like total cholesterol, HDL, LDL, but they very rarely check for fibrinogen. And if you can have all those other values at a normal level, but if your fibrinogen is high, well, it can stimulate the development of heart disease. Individuals with low plasma fibrinogen had a low incidence of coronary events even when serum LDL cholesterol was high. Now that's interesting because serum LDL is considered the primary risk factor for cardiovascular disease because it's involved in the progression of atherosclerosis, or the production of plaque inside arteries, which includes blood flow. And when the plaque breaks off, it can cause a heart attack or stroke. The Scottish Heart Health Study followed 10,359 men and women for 2 years, and fibrinogen was the single most powerful risk factor for cardiovascular disease risk or death, and more predictive than lipoprotein cholesterol, that's LDL. The increase in relative risk between the highest and lowest fibrinogen levels was 301% for men and 342% for women. That's cardiovascular death, and 259% for men and 220% for women related to death from any cause. GHK, how does it help with the fibrinogen? It suppresses the production of interleukin-6, which is a regulator of fibrinogen production in both cell cultures and mice. According to gene profiling data, GHK downregulates by 475% the gene for the beta chain of fibrinogen. In other words, on a genetic level, it also reduces the production of fibrinogen. Not enough to cause you to bleed to death, but enough to prevent fibrinogen from causing cardiovascular disease. The GHK has also shown anti-cancer effects. Again, these are isolated cells. I'm not to get into it. GHK also stimulates a process in the body, one of the main catabolic protein systems called the ubiquitin proteasome system. Now, the ubiquitin proteasome system is one of the main systems which breaks down muscle. So you might say, wait a minute, this stuff stimulates a body system that breaks down muscle. That's no good. However, you have to understand a lot of, let's say, damaged proteins can accumulate in the body, and not only do they inhibit the production of new proteins that are involved in developing muscle, but they also are a negative factor in the aging process. So you want to have a certain level of stimulation of ubiquitin proteasome. In fact, a deficiency in optimal proteasome is considered, or the regulation of protein balance is considered one of the main hallmarks of aging. It's one of the main causes of aging. So also, GHK has been shown to have anti-pain, anti-anxiety, and anti-aggression actions. It might be good for those guys taking a lot of steroids who experience roid rage, because the GHK can modulate the let's say the personality, so you're not as aggressive. Again, this is animal studies. It can actually, even topical GHK can do that. It shows tremendous anti-anxiety effects. Also, there's one other thing I wanted to mention about GHK. It's the fact that it can, in mice, it was shown to reverse age-related cognitive defects, meaning, for example, you have something called minimum cognitive impairment in humans. This is not dementia. It is not Alzheimer's disease. But a lot of people, when they get older, they might forget where they put their keys, or they might have a little short-term memory deficits. Now, I hate to admit it, but I have a little bit of that myself. Very often, I'll watch a movie, and then about an hour later, I try to remember the title of the movie, and I can't remember it. And I had just seen the movie 2 hours earlier. This is a symptom of minimum cognitive deficit. It doesn't mean that I have dementia, or I'm definitely going to get dementia. It just means that it's a little bit of a sign of aging. I'm not sure there's much you could do about it. I always do, by the way, remember the title of the movie. As soon as I start thinking of something else, the title comes back to me. But GHK peptide might help with minimum cognitive impairment in humans. It does in mice. So I'll leave it at that. In case you're wondering, this GHK copper peptide is widely available. It's all over the internet. I did a little search for it. There's a lot of topical preparations, probably for skin use, for the reasons I disclosed in this video. It's very, very good for the skin. There's no question about it. Like I say, even though the bulk of studies on GHK peptide have been in animals and test tubes, there is several human studies, as I discussed, which show remarkable skin healing and regenerative effects. So it's not that expensive, which surprised me. I thought that something like this would be really expensive. Some of them seem to average anywhere from $25 to $35. It's not that much. I'm talking about the topical. It's even available, from what I could see, in capsules, which is a little bit more expensive. In case I know somebody watching this video might leave a comment, Jerry, could you please tell me a good brand name because I want to try GHK peptide. I can't verify whether any of these products actually contain active GHK copper peptide. I can't verify the honesty of the company and product labeling, whether the product contains the amount of GHK copper peptide that's listed on the label. So unfortunately, I wish I could tell you of a reputable brand for GHK copper peptide. I cannot. You just have to, maybe if you're interested in this stuff, experiment on your own, or possibly if you want to take it a step further, you might contact the company that sells the product that you're considering buying and ask them to send you a chemical analysis of the product, which they should have no problem doing if they're an honest company, to prove that their product contains actual GHK copper peptide. In that sense, it would probably be worth buying the product if they supply that information to you, especially considering it's not an overly expensive product. I haven't used copper. I just read the research on this. I admit, as I admitted at the start of this video, I knew nothing about this GHK copper peptide. There's God knows how many peptides. They're always coming out with new peptides, new activities of peptides, new properties of peptides. Very difficult to keep up with all of them. I know a lot about some of them. Others, like GHK copper peptide, I knew nothing about whatsoever. So I had to do a little bit of research even to talk about this stuff. So, of course, I haven't tried it yet myself. Will I try it? Probably. I might try the topical form just to see if it does anything for my aging skin. And if I try and it works, I'll tell you what, I'll let you know. But that's about it for copper peptides. Copper peptides. I got to get the marbles out of them. Anyway, so that's it for this video. If you want more information on nutrition, exercise science, anti-aging research, including things like peptides and hormones, exercise science, as I said, supplement science, effective fat loss techniques, you name it, women's health and fitness, all of this is covered in my Applied Metabolics. It's anywhere from 30 to 45, 50 pages a month, no advertisements. I'm not aligned with any supplement company, so I don't push any products, like about 98% of YouTube videos, and a lot of the information on your internet is commercially biased. You won't find that in Applied Metabolics. I just give you the solid, evidence-based information that includes my over 60 years of constant study and experience. It's www.appliedmetabolics.com. When you subscribe, shoot me an email or send me an email. There's too much shooting going on, so send me the email, and I'll send you an invitation to join my private Applied Metabolic Facebook page, where every day I post brand new information on nutrition, exercise, and medicine, and I also answer questions from my Applied Metabolic subscribers. Of course, that Facebook group is only open to current Applied Metabolics subscribers. I have an email portal on my Applied Metabolics webpage, again, only for current subscribers of Applied Metabolics, where current subscribers can ask me short questions about anything they might have read in Applied Metabolics or anything pertaining to nutrition, exercise, and as an appreciation of their subscription, I will answer their question. So that's just a kind of a bonus for your subscription. Again, it's www.appliedmetabolics.com. If you want to have your best, if you want to get the best friend you'll ever have, get a dog. Some of you who are regular subscribers to my channel, by the way, that's another thing. If you find my videos useful, it's just plain vanilla. You know, it's just me looking into the camera and talking. I don't have fancy graphics or dancing girls. Personally, I find those graphics distracting. I don't think they help anyway. They don't do crap. You know, flashing a medical study, what's that going to do? You can't even read it. I mean, you know, these videos, you ever see them? They flash a medical study. The print, you couldn't even read it with an electron microscope. It's pointless. I mean, there's no point to it. So I just give you solid information. So if you feel that my videos are useful, please let others know about it so I can grow this channel a bit. Subscribe to it yourself and let others know about it. And, you know, get a dog. They're the best. I still haven't gotten a dog. It's been over a year since Bruno died. I'm going to get a dog. I just, you know, it's a little bit difficult. I'm still kind of hurting over the loss of Bruno, but having dogs now for about 25 years, it's very weird not to have a dog. It's very uncomfortable because they're great companions. I mean, they're terrific. And they're the best friends you'll ever have. They're 100% loyal. They'll never stick a knife in your back. And they'll love you under every single condition possible. So get a dog. Please save a dog from the shelter. There's all kinds of wonderful dogs at shelters. Most of them are put there for stupid reasons, and they're just begging for a home. They will be your best friend. And some of the best dogs, by the way, I'll quickly end with this, are older dogs. Don't overlook older dogs. You know, I've had most of my dogs have been older dogs. They're great. There's nothing wrong with puppies. They just take a lot more work. You know, if you want to deal with raising a puppy, that's great. But, you know, older dogs are just fantastic. Take care. Thanks for listening.